and now I am going to tackle about the typology of learners with special needs. Are you interested to know? Okay. So one of the typology of learners with special needs is speech and language disorder. Speech and language disorder is a kind of communication disorder that refers to difficulty in communication and related areas in oral motor function. When we say oral motor function, it is the movements of the muscles in the mouth, jaw, tongue, lips, and cheeks. And speech and language disorder is classified into two, which is speech disorder and language disorder. But let us first focus on what is speech disorder. Speech disorder refers to problem in voice quality and struggles in producing speech sounds. In this typology, learners are having difficulty in delivering his or her speech sounds of what he or she wants to convey. So, in this typology, maglisod sila og litok sa ilang angay nga istorya. One of the most common examples of speech disorder is stuttering. Stuttering is a speech disorder characterized by repetition of sounds, syllables, or words, prolongation of sounds, and interruptions in speech known as blocks. An individual who stutters exactly knows what he or she would like to say, but has trouble producing a normal flow of speech. Next is, how can we know that this or that person is having a speech disorder? So now, let us know their characteristics. First characteristics is trouble forming sounds called articulation or phonological disorders. In these characteristics, learners are having difficulty to deliver the right words and sounds to say. Second is difficulties with the pitch, volume, or quality of the voice. Maglisod silang adjust sa ilang mga tingog. Third is may display stuttering, an interruption in the flow of speech. Fourth, omits or substitutes sounds when pronouncing words. Like for example, instead of saying radio, they will say radio. Fifth is does not use appropriate speaking volume, too loud or too soft. Sixth is may have a breathy, husky, or monotone voice, unchanging in pitch and without intonation. Seventh is continually sounds congested. Maglisod jud sila og istorya. And lastly, frequently prolongs or repeats sounds, words, phrases, and or sentences during speech. Magbalik-balik na ang ilahang ipang-ingon. Next is, nganong naa may speech disorder? Now, let us know the factors that serve as the cause of speech defect. First is intellectual disabilities. It is used when there are limits to a person's ability to learn at an expected level and function in daily life. In this factor, limitado ra gayud ilahang panghunahuna. Second is hearing loss, not able to hear, dili makadungog. Third and fourth is brain injury and neurological disorders, problema sa utok. Fifth is drug abuse, sobraan sa pag-inom sa tambal. Sixth is cleft lip or palate impairments. It happens when the structures that form the upper lip or palate fail to join together when a baby is developing in the womb. And lastly, vocal abuse or misuse. Too much talking, shouting, coughing, smoking, and constant clearing of the throat.
So good morning, class. By the way, I am Teacher Lovely Cislas. You can call me Teacher Cislas. So for my discussion, I will give you some information about language disorder. So before I'll start to our main discussion, can I ask you, class, are you familiar of a language disorder? Yes, all of us know this kind of disorder, or let me say language disorder. So class, what is language disorder? So language disorder is an impairment in the ability to understand and or use words in context both verbally and non-verbally. Learners who have language disorder may have trouble understanding language and communicating. So class, there are some characteristics in language disorder. So what are those, class? First, we have improper use of words and their meanings. Second, inability to express ideas. Third, inappropriate grammatical patterns. Fourth, reduced vocabulary. And lastly, inability to follow directions. One or a combination of these characteristics may occur in learners who are affected language learning with special needs or developmental language delay. Learners may hear or see a word but not be able to understand its meaning. They may have trouble getting others to understand what they are trying to communicate. So, aside from having a characteristics, there are also three kinds of language disorder. So first we have receptive, second, expressive, and lastly, mixed receptive expressive language disorder. So class, what is receptive language disorder? Receptive language disorder is where a learner has trouble understanding words, what they hear and read. For example, understanding what people say, understanding gestures, understanding concepts and ideas, understanding what they read, learning new words, answering questions, following directions, and identifying objects. While in expressive language disorder class is where a learner has trouble speaking with others and expressing thoughts and feelings. For example, using words correctly, expressing thoughts and ideas, telling stories, using gestures, asking questions, singing songs, or reciting poems, and lastly, naming objects. And lastly, in mixed receptive expressive language disorder is where a learner has trouble in understanding and using spoken language. So next is factors serve as the cause of language disorder. So first we have cognitive limitation or mental retardation. So in this case, learners' cognitive limitation may take longer to learn to speak, wait, and take care of their personal needs such as dressing or eating. They are likely to have trouble learning in school. They will learn, but it will take them longer. There may be some things they cannot learn. This limitation will cause a child to learn and develop slowly than a typical child. Next is hearing impairment. Hearing loss can affect a learner's development of speech and language skills. When a learner has difficulty hearing, the areas of the brain used for communication may not develop appropriately. This makes understanding and taking very difficult. Third, we have behavioral disorder. So learners with behavioral disorder may feel frustrated that they cannot understand or others make themselves understood, and they may act helpless or withdraw. And lastly, we have environmental deprivation. So for learners living and growing up in institution, this often means that they will have difficulty learning and developing social skills. These children are also much likely to exhibit risky behavior or suffer from depression or severe anxiety when older. So next is, how will you create an interesting learning environment for students with speech and language disorder? So as an educator, to create an interesting learning environment for learners with special needs, I must first provide interesting materials. When children are curious, there is a strong tendency that they will ask questions. Second, keep the favorite materials or toys of the child out of his reach to encourage him to communicate his needs. Third, give opportunity to make choices. When the children are given the chance to choose a toy or an activity, there is a likelihood that they will be more cooperative to engage in a conversation. Fourth, do something unexpected like calling him with a different name or giving him the wrong art kit. This situation can be a springboard to a conversation. Fifth is give inadequate portions like hiding some pieces of the puzzle. This can motivate the child to report or ask for the missing piece. Sixth, provide activities that require assistance like using a knife to cut fruits and vegetables or opening a container of a cookies or popcorn. So as an educator, to help learners with language disorder and to make them feel sense of belonging, I must use toys, books, objects, or picture to help with language development. Second, have the learners do simple activities such as craft projects. Third, also have the learners practice asking and answering questions. By doing this, teacher will be able to caught the attention of the learners' interest to engage and to learn the way they want. This must be the best way for them to meet their needs in order for the learners with special needs to be functional and independent.
So thank you so much, Teacher Marilu and Teacher Lovely, for briefly explaining to us what is the typology of learners with special needs, specifically the speech and language disorder. So what is autism? So the word autism comes from the Greek word autos, or the word autistic, which means to escape from reality. Autism is a spectrum disorder or a lifelong disability which is more common to boys. So males are 4 times more likely to have autism than females. So autism is a developmental disability that affects the verbal and nonverbal communication and the social interaction of a child. So now let us proceed to the causes of autism. So there are 2 factors that we need to consider when we conclude the causes of autism. So number 1 is the genetic factor. So there are people that have strong genetic predisposition. So it means that autism can possibly be passed from the parents to the children or from their genes. Second factor is the environmental factor. So parental age can possibly be one of the reasons why children can acquire autism. So women at the age of 40, or women who gives birth at the age of 40 has a greater chance of conceiving the baby with autism. So kato ko nung mga nanganak at the age of 40, mas dako ang posibilidad nga ang ilang baby is magka-autism. So another reason for the environmental factor is kanang pregnant women who are exposed to alcohol, kanang mga cigarettes or other alcoholic beverages or other kinds of drugs. So there are 4 characteristics of autism. So number 1 is the impairment in social interaction. Number 2 is the impairment in behavior. Number 3 is the impairment in communication. And lastly, the impairment on sensory processing. So let us start with the impairment on social interaction. So mauni siya ang characteristics sa autism nga nga nag-affect sa ilahang social skills towards other people or towards their environment. So how can we say that a child has a social interaction impairment? So one characteristics under that is the child prefers to play alone or doesn't want to make friends. So mas gusto siya nga mag-inusara than to makighalubilo with his or her peers. So another is lack of eye contact or facial expressions or gestures. Like if magstorya kanila, they show less emotions. So another characteristics of the social interaction impairment is when kanang imong tawgon ng child with his or her name, dili sila mo respond, and dili pud na sila ganahan like mga physical touch. They are unaware and disinterested sa ilahang environment or sa ilang surroundings. So another characteristics of autism is the impairment in communication. So under the impairment of communication is kanang the child repeats the word or phrases over and over again, kanang balik-baliko nila og storya ang kaninga certain nga word nga phrase. Then another is kanang they make verbal noises while they are listening to other people, no? Kanang muras lang mo interrupt sa kanang when someone is kanang nagstorya. Then another characteristics under the impairment on communication is they rarely ask questions or they hardly answer or they have difficulties in answering questions. So the third characteristics of autism is the impairments in behavior. So under the impairments of behavior, mauna sila ang repetitive movements nga gihimo sa child, like arm flopping, kanang running, kanang even head banging. Ilan ang mabuhat with under the impairments in behavior. So another is kanang they have difficulties in waiting for their turn. So diha namusod ang kanang mga tantrums, like kanang spinning, ang running, cause they have less patience, no? They have difficulties on coping with their patience. So the last characteristics of autism is the impairment in sensory processing. So when we say sensory, diha namusulod ang 5 senses. So with this, they feel no pain or even sa ilang sight, sa ilang hearing, sa ilang smell, or sa ilang touch, or even sa ilang taste. So now let's proceed to the school-based programs of autism or relating to autism. So the treatment and education of autistic and related communication for handicapped children suggested the structured teaching intervention as one of the teaching techniques or learning approach that can be used for children with autism. So there are 4 main dimensions in the structured teaching intervention. So let us start with the physical structure. So think of a pyramid. So I will show you guys here. So let us put the physical structure at the bottom because it is the foundation of structured teaching. So mao jud ni siya ang nagpabarug sa tibuok nga structure sa teaching intervention. So the physical structure is where you set up or where you place your materials, the materials that you need in teaching. So how can we build a physical structure that best fits our learners with autism? So with this, we need to make sure that the area is quiet and peaceful for the learners to stay focused and relaxed. Kay dili na sila gusto og kanang saba, so we need to minimize the auditory and visual distractions. So kanang mga gipapilit nimo sa classroom or sa ilang learning space, or kanang we need to avoid kanang colorful curtains or kanang mga like colorful paints. So we need to focus with kanang mga neutral colors nga dili sila ma-distract kay it may slow down the learning process of a learner, or it may slow down their stimuli that may affect the processing of the learner's knowledge. So next is the visual schedule. So visual schedule is the common strength of learners with autism spectrum disorder, because it helps them in their verbal communication, and it also avoids language complexities. And when we say verbal schedules, it is or it helps the learners to be aware of what will be the upcoming activities that they will be done. So from the word schedules, it is ang mga buhatunon sa estudyante, and from the word visual, presented visually with photographs or visual boards, something maka-attract sa attention sa child. So next is the work systems. So the work systems is very important because it gives us it serves as the learning outcomes or what is expected of the child in the learning environment. So with this, it helps them to, or it helps us to monitor the child's task, their activities, because we are building them to be independent. We are helping them to be to build independence for themselves, so for them to be functional, for them to be functional and to be independent in the future. So this is why work system is very crucial, because with this we help the learner to evaluate the outcomes of their activities that is shown in the visual schedule. So lastly is the task organization. So the organization of the task helps determine if the child can really work independently. So in here we can conclude, or we can answer the questions if can the child really be independent, can the child really be functional, or it is also shown in the task organization that the final outcomes of the child. So again, let us go back our eyes here in the pyramid. So at the bottom of the pyramid, we have the physical structure, which is the foundation, or where we can set up a learning environment for learners with autism. So next is the visual scheduling, which is the visual representation of the upcoming activities that will be done with our learners. Next is the work systems, where we can develop the learning outcomes. And lastly is the task organization, where we can really conclude if the learner can really be an independent and a functional member of the society. So that's it for the structured teaching intervention. So an additional learning approach is what we call the discrete trial teaching, or the DTT. So DTT is a one-on-one session between the teacher and the learner. So it is a step-by-step process for the learner to slowly build the knowledge and understand certain lessons. So now let us proceed to the emotional and developmental model. So one famous technique in this model is the floor time, wherein the child is given 20 to 30 minutes to sit on the floor and interact with others. Since autism affects the social interaction of learners, floor time really helps the comprehension and the social interaction of learners towards their peers and towards the people around them. So now let me pass the virtual floor to Teacher Harry to further discuss to us what are the other typology of learners with special needs.
Hello, I am Teacher Harry of Group 4. Are you all excited to learn? Then let's go. I will be discussing to you the definition, identification, classification, and school-based programs for learners with deafness and hard of hearing impairment. Hearing impairment, hearing loss, or deafness is a total or partial inability to hear sounds. Hearing impairment, permanent or fluctuating, adversely affects a learner's academic performance. Hearing loss is used to people with residual or remaining hearing and can understand speech. While deafness is hearing is non-functional, it prevents the child or a person from receiving sounds in all forms. To identify learners with hearing difficulty, observe a student and see if he/she does the following: speaking loudly, positioning ear toward the direction of the one speaking, asking for information to be repeated again and again, delayed development of speech, watching the face of the speaker intently, favoring one ear, not responding when called, has difficulty following directions, does not mind loud noises, and leaning close to the source of sounds. Now, let's move on to classification of deafness and hearing impairment. First is conductive hearing loss. People with this kind of condition can hear when the sound is loud enough. This is because of the infection of the middle ear. Second is sensorineural hearing loss. The person with this kind of condition loses his hearing sensitivity and sounds and speech that what he hears are often distorted and it's not heard clearly. The usual cause of sensorineural hearing loss are viral diseases, too much exposure to noise, and aging. Third is mixed hearing loss. The impairment in the outer or middle ear may be treated, but still the person may experience a hearing loss due to the impairment in the inner or in the auditory nerves. Fourth is central hearing disorder. The person affected with this kind of condition may experience a hearing loss or not at all. The person may hear but he cannot understand the speech or the sound heard. Fifth is functional or non-organic hearing loss. And this type of hearing loss, the person's experience is not consistent with laboratory results. The person may experience a hearing loss, but when tested during the audiometric evaluation, the result does not yield organic hearing loss. Causes of speech and language disorder. First is genetic or hereditary factors. Second is infections like bacterial and viral meningitis. Third is developmental abnormalities like malformation of the middle ear. And fourth is environmental or traumatic factor like intense noise. So what are the school-based programs for learners with deaf and hard of hearing impairment? There are three major approaches in teaching students with hearing impairment. These are oral approach, total communication, and bilingual bicultural approach. First is oral approaches. In this technique, the child is trained to use his residual hearing and talk with hearing peers through the help of amplification, such as hearing aid, auditory training, and speech reading. The child is trained to express himself and understand others through the use of residual hearing. Second is auditory training. The training includes detecting the sound, discriminating the sounds, identifying the sounds, and understanding the meaning of the sounds. At the first stage of the training, the teacher will teach the child how to detect the sound by exposing him to different sources such as telephone, doorbell, alarm clock, or running water. Another part of the training is to help the child discriminate or tell the difference between two sounds. For example, noting the difference between happy and angry voice, cat and dog, or man and woman. Third, speech reading. This technique is also known as lip reading. The person watches or observes the speaker's lips, facial expression, gestures, and use his residual bearing to help him understand what the other person is saying. Fourth is cued speech. Cued speech is a visual mode of communication in which mouth movements of speech combined with cues to make the sounds or phonemes of traditional spoken language look different. A fifth is visual phonics. It's a system of 46 unique hand cues and symbols that represents the sounds of English. All learners were taught a hand cue for each of the 46 sounds in English. 6 is total communication. This is also called simultaneous communication or SIMCOM because it supports the use of different forms of communication and teaching the students. In this technique, the teacher and students are allowed to speak while they sign during their class. 7 is finger spelling. This is manual alphabet used to spell proper nouns without existing sign. It features 26 unique hand positions representing each letter of the alphabet, like A, B, C, and D. Last is the American Sign Language or ASL. ASL is a visual spatial language in which the shape, location, and movement pattern of the hands, the intensity of the motions, and the assigner's facial expression all communicate the meaning and the content. To support students in your classroom, make sitting changes. Learners with hearing loss may need to sit closer to the front of the class to speech read or read lips, or hear more clearly. Minimize background noise when possible. This may mean finding quiet areas for a student to work. And face students when you speak. Most students with hearing loss can speech read to some extent. To help them, face them when you talk slowly and clearly. Use lots of pictures, graphics, and text labels. Many students with hearing trouble are visual learners. Teachers should be more patient when waiting to hear a response from a hearing impaired student, which may take longer than usual. And last, a variety of multisensory activities should be given to allow the students to focus on their learning strengths. Teachers, I hope you listened very well there. To continue the discussion, Teacher Alea will take over. And once again, this is Teacher Harry.
Hello, so the next topic is visual impairment. So what is visual impairment? Visual impairment is a general term used to describe people who cannot see even with corrections. It involves an issue with sight which interferes the student's academic pursuits. So, a student may not be able to see objects at a distance like on a blackboard or in a whiteboard, and may having a trouble reading or learning to read and participating in class, and they may not be able to focus on objects. So the Individuals with Disabilities Education Act, or the IDEA, further explains that it is impairment in vision that even with correction adversely affects an individual's educational performance. It includes problem in visual acuity, visual field, and perceiving the color. The condition may vary from one person to another. One person may have no remaining vision while others have remaining functional visions. So, there are 4 classifications of visual impairment. First is the legally blind, second is the totally blind, third is the partially sighted, and fourth is the low vision. So, individuals who are legally blind have minimal light or form perception. It has 20/200 vision in the better eye. For example, a normal vision is 20/20, wherein you can see clearly 200 feet away in your vision. But when you are legally blind, you can see 20 feet. A normal vision can see in 200 feet. Next is when an individual is totally blind, it is completely lacks vision or totally without any sight. Third is those who are partially sighted have limited perception with the environment. For example, you may have blurry vision or the inability to distinguish the shapes of the objects. So, legally blind, totally blind, and partially sighted are dependent on their tactile or sense of touch and auditory or their sense of hearing as the channel of learning. Lastly is a person is considered as having a low vision when he still has a residual or remaining vision that he can use with the help of prescription or non-prescription devices. Typically, the person cannot read a book or newspaper at a normal distance even when he is using eyeglass or contact lens. There are also people who are called deaf-blind. They have limited vision and hearing, so Braille and sign language are both used to train these individuals. Okay, so let's move to the causes of visual impairment. There are 12 causes of visual impairment. First is the myopia or the nearsightedness. And the individual can see clearly when the object is close to. This is the result when rays of light from distant objects are not focused on the retina. So the retina is the light-sensitive layer of our nerve. It is responsible for our visual processes. And next is the second cause, which is the hyperopia or the farsightedness. This is the opposite of myopia, since the person can see clearer if the object is far. In this condition, the light rays near the objects are not focused on the retina. Third is the astigmatism or the blurred vision. The person sees a blurry image of the things around him due to the curve in the cornea or lens. As a result, the curve prevents light rays from focusing the retina. Just like myopia and hyperopia, astigmatism can be corrected through the eyeglasses and contact lenses prescribed by the optometrist. Fourth cause is the cataracts. The person with this condition experiences a blurred, distorted, or incomplete vision due to the cloudiness of the lenses because of trauma or old age. Since the lenses are opaque or cloudy, this blocks the light needed to see clearly. Additionally, the person can be photophobic, may experience serious glare problems, and squinting. Fifth is the glaucoma. This condition occurs when the aqueous fluid, it is the watery or water solvent, fails to circulate properly. The pressure in the eye caused by the fluid can damage the optic nerves and can further result to loss of visual acuity and visual field. So visual acuity is the measure of the ability of the eye, and visual field is an entire area that an eye can see when it is fixed straight. Sixth is the diabetic retinopathy. From the name itself, diabetic, individuals are affected with this type of eye disorder. This occurs when there is a hemorrhage and continuous growth of blood vessels in the retina. It is often treated with laser surgery. So this eye disorder is caused by a diabetes. Then seventh is a retinitis pigmentosa. This is the gradual degeneration of the retina. It can result to night blindness, photophobia, and loss of macular vision. This condition is inherited and not treatable. Eighth is the Usher syndrome. This is a deaf-blind condition which is a combination of congenital deafness and retinitis pigmentosa. Ninth is the macular degeneration. This condition is typical to adults, but it can also affect young people. This is due to deterioration of the central area of the retina cones. So visual fields are lost, but the person can use his peripheral vision. The person may also be a photophobic that affects his color vision. 10th is the retrolental fibroplasia, typical to premature babies who are overexposed to oxygen in the incubator. 11th is the optic nerve atrophy, damage of the optic nerve. So the optic nerve carries the images of what the eye sees to the brain. 12th and lastly is the ocular albinism, a genetic condition that primarily affects the eyes. This condition reduces the coloring or the pigmentation. Now let's proceed to the school-based programs. In the Philippines, one can rarely see a student with vision loss in inclusive education. Most of them are studying in a special school. The Philippine School for the Deaf and Blind in Pasay City specialize in teaching students with such condition. Special education teachers who will teach students with vision loss need an intensive training in using the Braille. So the following are some suggestions for teachers who have students with low vision. So first is they need to train the child to use their functional vision. So the teacher may conduct a functional vision assessment to find out how their students use their vision. Because by knowing the information about how they use their vision, it can help the teacher on how to support the student to use their functional vision efficiently for their education. Second is to illuminate classroom properly. From the word illuminate, which is the brightness from the shining of a light, teachers needs to adjust their classroom lighting for some students who have a impaired vision. Third is to have sight to sit near the blackboard. So as what I have mentioned earlier, a person with low vision cannot see clearly in a normal distance. So the teachers should cite an exact seat for the kind of students. Then fourth is they should give photocopy of the lecture notes or shorten the notes, because this empowers the students to have their own adaptation, and also it allows them to have more access. Fifth is to verbalize the writings on the chalkboard. Since students has low vision, teachers should verbalize or say clearly and loudly on what is in the board. Sixth and lastly is the avoid cluttering the board. So teachers should organize or simplify on what will be they putting on the board so that it can be easily identified or read by the students. So in school-based programs, there are 3 aids that a teacher can use to teach and support their students. So first is the tactile aids. In tactile aids, Braille is being used. Braille is a system of touch reading and writing for blind persons in which raised dots represent the letters of the alphabet. It also contains equivalents for punctuation marks and provides symbols to show letter groupings. People read Braille by moving the hand or hands from left to right along each line. Second is Brailler. This is often used by younger students to learn how to write Braille. It looks like a typewriter with 6 key dots. A special paper is also needed to punch the raised Braille dots. Third is a slate and stylus. This device is often used by older students. The Braille dots are punched by hand on a special paper. This is more convenient because it is smaller and quieter than the Braille. Other examples under this tactile category are the tactile experience book, embossed maps and diagrams, and 3-dimensional models. So fourth is the orientation and the mobility program. It is important to teach students with visual impairment to be aware of his environment and to train him to move safely and efficiently from one environment to another. The teacher can give a child an obstacle course where he can practice moving within the environment and gain control over the situation. Fifth is the cane. The use of cane is very important for individuals who have vision loss and who travels alone. The cane serves as their guide in walking, which can give them an insight about the environment. They can gain information if there are obstacles such as bumps, open manholes, door, and travel surface. Sixth is the sighted guides. The teacher should demonstrate to sighted students how they can assist their classmates who has vision loss. However, this should be done moderately, only when the blind person is new in an environment to avoid dependency. Here are some of the sight-guided techniques. So, you may greet the person in a normal voice and ask him if you can help him. Next is let him take your arm by holding the part of your elbow. Third is walk in a normal voice and describe if there is a curb, stair, door, or other obstacle along the way. And when sitting, place the person's hand on the chair and let him sit alone. And then seventh, guide dogs. Dogs are trained to follow several basic commands, and they wear special harness to guide the person with vision loss to travel alone in complicated routes. Next aid is the manipulative. First is the Cuisinart rods. By touching the rod to determine the length and markings associated with each rod, the student with vision loss can also develop his mathematical skills and concepts with the use of this manipulative. Second is the Cranmer abacus. Abacus is helpful for students with vision loss in practice number concepts. Third is the talking calculator. It is an electronic calculator that performs most operations of a standard calculator, but the only difference is that it talks. Fourth is optical devices. Optical devices are often used to accommodate students with low vision. The following are some of the common type of these devices: eyeglass, telescope, contact lenses, magnifier, and large print materials. The third and last aid is the technological aid. So first is the closed circuit television or the CCTV. This device is particularly helpful for students with low vision to read on printed text. Second is the Optacon. It is a small handheld electronic device that converts regular print into a readable vibrating form. For instance, when Optacon is held over the printed S, the person can feel at the tip of his hand the graceful curve of S going to the left to the right. Third is the Kurzweil 1000. This machine has an optical character recognition system that reads printed and electronic messages. Another high-tech technological aid is the Braille in Speech. It translates Braille into speech or print. Fourth is the Electronic Travel Guide. Global Positioning System, GPS, can announce to the user where his control location is. Canes with laser beam can convert the light into sounds or vibration and can alert the user if there are obstacles along his path. So now we are in the last part of visual impairment, and it is the educator's perspective. So, educator's perspective develop a non-verbal or touch and verbal commands. First example is clap, tap, and present different tone of voice for the child to identify different kinds of emotion. So in this, teachers may assign a specific emotion on what will the students do if they want to express their emotion. So for example, they may clap if they are happy, and they may tap if they are sad. Second is make no changes in the particular. Example, all furniture must not be moved for the child to be familiar with all the furniture and their specific places, so the child will not have any difficulty in going around the house. Third is do physical activities such as exercises to develop the body. Fourth is develop the sense of hearing and touch with activities or in a form of play for some. Example, hulaan. The child will be asked what sound was heard and what object was touched. Then the child will be asked to describe the object and sound. And fifth is teach basic household chores. And that's because when we are making the child some chores, he has a role in the house. He will feel that he is part of the house and he can do something to help the family, which gives him a sense of purpose. So basic chores can be done such as folding the clothes, sweeping the floor, and assisting in cooking. So that's all for my topic, and thank you all for listening.